So now Dr. Liebenson is going to show us how he tests the strength of the QL to see if it's weak. So go ahead.
The quadratus lumborum test comes from Professor McGill's lab at University of Waterloo. What I'd like you to do, Chad, is lay on your side, prop up on your forearm, both legs straight out, top leg in front. That's it. And come all the way up, hips forward. And this would be the endurance test. The most important thing here is not how long Chad can stay in this position, but it's going to be the symmetry of one side versus the other. And just relax. Ideally, Chad would be able to go about a minute on one side and about a minute on the other side. If one side was 40 seconds and the other side was a minute and 20, that would be a huge asymmetry. It's that asymmetry that's the most important thing. We do, however, need to have a minimum amount of endurance or fatigue resistance, and at a minimum, I'd like to see about 30 to 40 seconds on each side.
Okay, sounds good. So test it on each side. Make sure there's no major discrepancies between sides. So now that we've tested the strength of the QL with the side plank, now Dr. Liebenson is going to show us a progression that he uses to strengthen the QL.
This first set of exercises, again, come from Professor McGill's lab. We're going to do a peel back from the plank, which we call the side bridge on the knees. So lay on your side, Chad,
Okay.
and bend both knees.
All right.
Perfect. Basically, we're in a squat position on our side. And from this position, it's just like a glute bridge. I want you to first off, just push off of your arm, activating your lats, and lift your hips forward, all the way forward, as far as you can. We want to make sure that we get into a plank. Come forward a little more. That's it. And now hinge with the hips and go back and down. Good. Push off from the elbow so your trunk rises up a little bit, and go forward. All the way forward. Good. And go back and down. Good. Sink a little bit. Let this sag. And now without lifting your hips, just lift here, just push off of your elbow. That's it. So that aligns the spine here, so we're no longer convex. Let it collapse again. And it also activates the lats to pack the shoulder back and down. So push off using your lats to align your spine, and now open up those hips. Open them all the way up, sticking your chest out. Perfect. Come forward even farther. So Chad's hip flexors are just a little bit tight. They restrict that a little bit. Go back and down. Good. Let it all sag. Start with the lats. Pack that shoulder back and down. Open those hips up all the way. And one of the things we're mindful of is we also notice that Chad is separating his knees. We want to keep those knees stacked. If they don't stack, we'll put a pillow between them. Go back and down. We would do this on both sides. And then we progress to the plank, which is what we did as the test. So let's go into the plank.
Okay.
A little bit more load on the spine in this position, a little bit more challenge on the muscle all the way up. But interestingly, it requires a little bit less coordination. And this is more in the plank family of exercises, whereas the side bridge on the knees is more in the squat or bridge family of exercises. The plank can be progressed to the plank roll. So slowly roll until you have both arms in position. Keep the pelvis and shoulders working. That's it. We're going to hold this position. Good. And let's get our arms back like this, Chad, because we're now going to roll the other way. Good. Stay at this height and start with this lat right here and roll towards the other side. So we're pushing off the whole time. We don't lose altitude. We want to stay up higher. Push up, push up, push up. This time when we return, we're going to groove the pattern so that we don't dip here. So keep that lat firing the whole time. Start to roll. Good. Keep your arms folded across so that we can make it seamless. Good. Hold there. Good. Turn towards me without dipping. Shoulders and pelvis linked together. Chest out. Good. Hold it. Don't dip. Don't dip. Roll all the way till you're perpendicular. Push off, activating the lat. So it's the lat, the obliques, the abdominals, quadratus lumborum. And now roll on all on the forearms again. That's it. Perfect. And now relax. Excellent. So that's a very simple first stage of exercise progression out of University of Waterloo, Professor Stuart McGill's lab. The side bridge on the knees, the side planks, and the plank roll.
Excellent. All right, I'm here with Dr. Craig Liebenson. Now we're to the second stage of training the QL. So this would be more functional type exercises as opposed to what we did before, which is isolating the muscle a little bit more. Can't isolate anything, but we kind of took some basic movement patterns out that the QL is typically involved in. So now we're going to train those patterns.
We're going to use the kettlebell. What's nice about using the kettlebell to train the quadratus lumborum is if we use a gait pattern, we can functionally work the quadratus lumborum the same way that it works in real life. In a sport where somebody is striking or kicking, they have to maintain stability of the pelvis in the frontal plane. There's a lot of destabilizing forces when we get into single leg and we tend to shift out. Then our shoulder gets unlevel. We might have a shoulder pain or a knee pain or an ankle pain. But we want to train that stability of stacked pelvis, stacked shoulder, and get the quadratus lumborum to work with its partner, which is the contralateral gluteus medius. So we're going to do a briefcase carry and a set of progressions using the kettlebell. So let's start with the kettlebell in your hand, Chad.
Okay.
And we're just going to have a normal gait, walking back and forth, keeping shoulders and hips squared off. That's it. Turn around. Monitor your patient to make sure that the shoulders and hips are level. We can go to the rack position, elbow in, so you have good core stability, and we just keep walking there. That's it. If I see any tipping or tilting in the frontal plane, I'm going to correct it. Now we can go bottoms up with the elbow in the same position using the core. Beautiful. Good. Forward and back. Bottoms up is going to require a lot more stability. But this has really revolutionized how we train people with overuse syndromes of the knee. We can do the same exercise overhead now.
Okay.
So let's try that. Good, all the way up. That's it. Core is going to work to stabilize the bottoms up position.
Hand slide. Hand slide.
This is not an easy exercise. People with overuse syndromes in the knee or issues with IT band friction syndromes or the knee collapsing into valgus overload typically have lateral stability issues. Historically, the lateral stability issues of the pelvis have been addressed with open chain gluteus medius exercises, any Audi type exercises, clamshell, or closed chain single leg balance and squat exercises, but now we can get the QL working concurrently by using the kettlebell and the gait pattern.
All right. So the QL, as you said, is typically linked with the glute medius on the opposite side. So does that mean if my left QL is weak, that my right glute medius might be weak, or it'll be tight, or what do you typically see?
It might be. More likely, the way that we would do our fact-finding in this case is if somebody has a right knee overuse syndrome, they've got patellar tendinitis, I'm almost always going to find that the ipsilateral gluteus medius is shut down.
Okay.
There's some amnesia in that muscle. It has a hard time activating. And if I isolate the gluteus medius and get it stronger, things will relapse until I concurrently get the sling, the oblique sling, with the contralateral QL.
Okay, excellent. All right,
One of the problems, if I can just interject, is if there's a shoulder pain. And if there's a shoulder pain, that is something that will handicap our ability to perform the test. And then what we might do is we might go into some of the other training options.
Okay.
And use the training options as tests, because as Professor Yanda always taught, every exercise is a test.
Yes, definitely. All right. Well said. So this is an alternative exercise to further challenge the QL, the left QL in this sense. So Dr. Liebenson, tell us why you use this and why it works.
Well, basically, Chad, in this exercise, which is called a baby get-up, we're going to combine some things from Pablo Collage's work from the DNS School of Thought, Dynamic Neuromuscular Stabilization out of Prague, with the traditional Turkish get-up. This is a great exercise for getting the abdominal wall and the quadratus lumborum to work together in a progression that a baby did when they were 7.5 or 8 months old.
Okay.
It's hardwired into the nervous system. It's particularly good for people that have shoulder issues because it's really going to help with the unpacking of the shoulder or the packing down of the shoulder.
Excellent.
So let's come on over here, get this foot mid-shin, And the balls of the foot against the apparatus here, against the pulley machine.
Okay.
Beautiful. We're going to make sure the elbow is underneath the shoulder. And we're going to stay on this knee, we're going to stay on this foot, and we're going to begin to get up. We're going to begin to raise up the pelvis. Beautiful. Perfect form. Good. And lower yourself. A lot of people will make the mistake of lifting this knee. Your technique is perfect. Make sure you give a little effort there to push off.
Okay.
So we get that dynamic.
So I'm pushing through the ball of my left foot, lifting my hips forward as far as they can go, keeping this knee down.
And we'll notice here that we've got, again, the perfect alignment here, from the ear to the shoulder to the hip to the knee. We're in a perfect plank here. We got here functionally, just like one would in a Turkish getup. The other component from DNS is that this is how the baby would move into the quadruped position. So as you come up, you're going to reach with your right arm.
Okay, reach straight out in front.
Yep, reach
Okay.
right across your body.
So I come up, reach
Good.
straight out.
That's it. And go on back and down. We'll do one more. If we took it to the next step, Chad would roll onto all fours, which would be a progression towards getting into a sumo squat position like a 12-month-old, and then eventually raising arms and standing up like a 13 or 14-month-old in an overhead squat.
Okay, excellent.
So that really turns on a lot of muscles. It helps a lot of people with shoulder problems to develop the lat strength and to change their posture so their upper traps and their levator scap aren't shrugging the shoulder all the time.
Yeah, because shoulder problems are everywhere these days, so this is a good alternative, because I will put someone in a side plank position and I'll be like, okay, do you feel your QL, your side core muscles? And they'll be like, no, it just hurts my shoulder. So this is a great alternative for people who have those problems.
Yeah, so in recap, we went over the basic exercises, the side bridge on knees, the side plank, and the plank roll, which is just a basic way to isolate those muscles in a stabilizing way,
Right.
in a functional way. And then we went upright using the kettlebell, which is just a really innovative way to get the QL and the contralateral gluteus medius working together to stabilize the frontal plane. And then finally, a more novel or innovative approach, which has its roots in developmental kinesiology.
All right, excellent. Now you all see why I'm studying under this guy. All right, he knows his stuff. So thanks a lot.
Thank you, Chad. It's
All
been
right.
fun. Thank you.